Long COVID in New Zealand. Who's at risk and why?
The unseen aftermath. Imagine this. You test positive for COVID-19. Your initial symptoms, fever, cough, fatigue, come and go in a few days. Relief sets in. But then, weeks later, something unexpected happens. You start experiencing brain fog, persistent fatigue, or a racing heart. What's going on? Is the virus really gone? Welcome to the world of long COVID, a phenomenon affecting tens of thousands here in New Zealand and millions worldwide. Understanding what really happens after the virus enters your body is crucial, not just for your recovery, but for anticipating potential long-term consequences. The virus inside. COVID-19 is caused by the SARS-CoV-2 virus. Once it enters your body, it targets cells lining your respiratory tract. But it doesn't stop there. This virus can affect your blood vessels, heart, brain, and even kidneys. Think of it like an uninvited guest that wanders through your house, touching every room. Some areas may seem untouched, but the damage is subtle, sometimes invisible, and can appear days, weeks, or months later. The body's immune system launches a response, producing antibodies to fight off the virus. But in some people, this immune reaction overshoots, causing inflammation that lingers. Acute versus long-term symptoms. Most people experience mild to moderate symptoms that last a week or two. But for a significant minority, symptoms persist. Fatigue, shortness of breath, chest pain, and cognitive difficulties, commonly called brain fog, are reported. Why? One theory suggests that viral fragments remain in the body, continuously triggering the immune system. Another theory points to the immune system accidentally attacking healthy tissues, a form of autoimmunity. New Zealand studies show that around 10 to 20% of COVID patients report lingering symptoms beyond 12 weeks. This isn't just numbers, it's real people struggling with everyday life. Who's at risk? While anyone can develop long COVID, research indicates certain groups are more vulnerable. Older adults, those with multiple pre-existing conditions, and people who experienced severe initial infections face higher risk. But even young, healthy Kiwis aren't immune. Studies suggest women report long COVID symptoms more frequently than men, for reasons still under investigation. Genetics, immune system differences, and even hormonal factors may play a role. The unpredictability is part of what makes this condition so worrying. Two people with similar infections can have dramatically different recoveries. The invisible strain on the body long COVID is not just feeling tired. It's a multi-system challenge. The virus can cause lingering inflammation in the lungs, heart, and brain. Some patients develop microclots in blood vessels, reducing oxygen delivery to organs. Others experience autonomic nervous system disruptions, leading to dizziness or rapid heart rate when standing. Imagine your body as a city. The streets are clogged, electricity flickers, and traffic lights malfunction. Everyday tasks that once seemed trivial suddenly become monumental. Cognitive and mental health impact. Beyond physical symptoms, long COVID affects the mind. Many report memory issues, difficulty concentrating, anxiety, and depression. Brain imaging studies suggest subtle changes in gray matter and white matter connectivity, though the mechanisms remain unclear. For those in New Zealand, returning to work or study can feel like climbing a steep hill every day. Mental health support becomes just as critical as medical care in managing recovery. Recovery pathways. Recovering from long COVID often requires a holistic approach. Medical teams focus on symptom management, physical rehabilitation, and mental health support. For fatigue, pacing activities and gradual exercise can help. Respiratory therapy can improve lung function. Cognitive rehabilitation exercises may restore mental sharpness. Importantly, patience is essential. Recovery timelines vary widely. Some improve in weeks, others take months. Think of it like repairing a damaged ecosystem. Everything needs time to rebalance. Vaccination and reinfection. Vaccination remains a critical tool. Evidence shows that vaccinated individuals who contract COVID tend to experience milder symptoms and a lower risk of long COVID. However, breakthrough infections can still occur, and reinfections are possible. Boosters continue to provide protection, especially for vulnerable populations. In New Zealand, public health campaigns emphasize this ongoing strategy, even as mask mandates and restrictions have eased. Real-world stories. Take Sarah from Auckland. She had a mild COVID infection, but 3 months later she still struggles with fatigue and short-term memory lapses. Or James from Wellington, a previously healthy runner who developed heart palpitations after infection. These stories highlight that long COVID isn't limited to the elderly or those with underlying conditions. It can touch anyone. Sharing experiences like these helps raise awareness and encourages timely medical consultation. Living with uncertainty. Long COVID challenges our sense of normalcy. You may never know exactly how long symptoms will last or how severe they might become. But research continues to advance, offering hope. New Zealand participates in international studies examining long-term effects, treatments, and recovery strategies. Monitoring symptoms, maintaining regular medical follow-ups, and pacing daily activities remain key steps. Knowledge, after all, is power. Understanding what's happening inside your body helps you regain control. Moving forward. The journey through and beyond COVID isn't always straightforward. Symptoms can come and go, but with proper support, many recover and regain quality of life. Awareness, timely intervention, and community support are crucial. Long COVID reminds us that even as the world moves on from pandemic restrictions, the virus's shadow can linger. By staying informed, listening to our bodies, and seeking care, we can navigate the uncertainties and protect our long-term health.
That's it for today. I'm Lutz N, and this is your Health Decoded NZ. Clarity Unlocked, so you can make sense of the facts and see the differences for yourself. Please remember to subscribe and feel free to leave a comment.